Hi, my name is Jenny Smith. This is for Oral Communications with Professor Haynes. The topic I'm going to discuss today involves medical errors in the healthcare field. This is something that hits close to home with me because I am an LPN. I have been a nurse for the past 5 years. I do mainly in-home pediatric nursing, but I have to deal with all kinds of different aspects of healthcare, anywhere from transcribing orders from doctors to calling in medications with pharmacists to setting up patients' rehab and that kind of thing. So anytime that there is any chance for any type of an information to go from one person to another, there's always the risk of miscommunication or any type of error can occur. This happens in all types, but in healthcare it's a lot different because the mistakes you make can be fatal. You would never think going into the hospital, for instance, that you would never come home again. But would you believe that in the medical field, medical errors account for between 44,000 and 98,000 deaths per year? To me, this is a little high of a statistic, and I think that could be changed. The numbers are undeniably startling. They suggest that more Americans are killed in the U.S. hospitals every 6 months than died in the Vietnam War, and some have compared the alleged rate to 3 fully loaded jumbo jets crashing every day. To me, that is ridiculous. There needs to be some kind of thing set in place to help us correct these medical errors. A 2006 study found that medication errors are among the most common medical mistakes made, which can happen very easily. There are so many doctors out there that have terrible handwriting, and one of the things they stress when you're in nursing school is to have good handwriting. At the same time, I kind of didn't understand. I mean, yes, we need to have good handwriting as a nurse for others to be able to read our writing, but they didn't really elaborate on how to read others' handwriting. I think you need to include a class on reading doctors' handwritings. That should be included in your nursing school. According to the study, 400,000 preventable drug-related injuries occurred each year in hospitals, 800 in long-term care facilities such as nursing homes, and roughly 530,000 among Medicare recipient in outpatient clinics, which would be like doctor's offices, clinics, that kind of thing. According to a 2002 Agency for Healthcare Research and Quality report, about 7,000 were estimated to die each year from medication errors. About 16% more deaths than the number attributed to work-related injuries, which is 6,000 deaths. This is such a large number that can be decreased so easily if the communication between prescriber and provider was more accurate. I have myself had a situation in where my own doctor had prescribed 180 of a certain pill, and the pharmacy had only filled 120 of this pill. I brought it to the pharmacist's attention. Well, actually, I didn't even realize it until I went to make my doctor's appointment, and my nurse said, well, you need to come in a week sooner because the doctor didn't give you the correct amount of medication. By that time, it had already been filled through Walmart, and my doctor brought it up with them, and there was absolutely nothing that they could do about it. It was a mistake made due to his illegible handwriting. He actually told me at the time to take pictures of my prescriptions every time that I received them from him so that I had a record of what medicines I was receiving. Anyway, like I said, after this happened, nothing could be done. The pharmacy did not correct their mistake, and really nothing happened over this. But you can see how there can be bad things happen due to medical errors like this. I mean, the breakdown could have easily been avoided. In my own personal situation, there was no actual harm done, but that's not always the case. I've read many different stories that vary from errors resulting in death to errors that left people blind and even wrong implants being placed in patients. These stories can be found on the sites I will be letting you know about later. If you'd like to read them more extensively, they are there's many different stories. Just the sheer number of people that have been injured or disabled permanently due to negligence of others is overwhelming. Most errors occurred from problems created by today's complex healthcare system.